Hi, this is Dr. Ferris with Elite Spine, and I got Michelle with me, and she's a special patient of ours. And she was telling me that she's been under upper cervical care since she was 17 years old. So quite a few years now. And she was under care with a doctor in California, and then she relocated to our area in Indiana. And so we've been taking care of her since then. And she was telling me when we first saw each other that she would deal with pretty darn intense headaches and neck pain, about a 9 out of 10 intensity,
Yes.
and also some left hip pain. And both from what she had done in the past and also what we've been able to continue to do, that when we have her upper neck under control nicely, her quality of life is way better and those things are much more under control. Is that right?
Yes.
Yeah.
Absolutely.
And so just share maybe a little bit, anything else tidbit wise that you think might be helpful for somebody just wanting a solution, and kind of how this option is very gentle and very effective.
I, as you know, have a great fear of cracking. So once I moved to Indianapolis, I knew that I had to continue the upper cervical care, which doesn't necessarily include that.
Yeah, it's very gentle.
It's very gentle. It's strange to even think about, watch. Simple pressing behind the ear, easy adjustment. I knew I had to keep that going, so I searched out, found this office, was very thankful that it wasn't that far from my house. Instantly had the relief of migraines, was able to maintain what my prior adjustments had done and just slip seamlessly back into it. And I know it's time to come back in when I start to get tired more often, and you don't recognize it right away, but then there's suddenly like day 3 of like lethargic, and then I'm like, oh, it's time for an adjustment.
Yeah.
And by the time I make the appointment, always easy to get in, but with my schedule, by the time I make the appointment, I'm like, wow, that's a world of difference.
And that's really helpful because a lot of patients tell me that everybody gets a little bit different kind of indication that they're starting to go out of alignment. Lots of different indicators. Sometimes it's the pain that they originally started with, but oftentimes it's something more subtle, like you mentioned. And if they catch that on the quick side and we get things back on track with the very gentle adjustment that we do, it doesn't move on to that next level of intensity.
Right.
And so, we're so happy to be able to take care of patients in such a precise and gentle way and help keep their conditions under control and get to the root cause of the problem. So thanks so much for sharing with us.
Thank you.